Hello, welcome to our arterial blood gases ABGs course. I'm so excited that you decided to take advantage of this training, and we're going to go ahead and get started right now. So this is Nurse Chioma, if you don't know who I am. So let's go and begin talking about ABGs. Now, first thing we're going to do is that we're going to set a foundation by first explaining what are ABGs, what's the purpose of ABGs, why do you need to know this, that kind of stuff. So arterial blood gas analysis, so this is pretty much the measurement of the patient's oxygenation, their carbon dioxide levels, and their acid-base balance inside the blood. So pretty much it's a way that we can measure how well they are receiving oxygen, how well that gas exchange is taking place, how high their CO2 levels are, how well their acid-base balance is, and we'll talk about that in another training too, in the blood. So it's even more accurate because we're literally taking a blood sample versus, doing, like, for example, O2 sat monitor, which is still accurate, but it's more accurate because it's coming from the blood. So ABGs, it's a more accurate measurement of the patient's oxygenation and their bicarbonate levels. Usually we collect ABGs to monitor patients with unstable hemodynamics. So this is going to be ICU patients, critical care patients, emergency patients, patients with lung statuses or poor lung diagnoses. We need to collect ABGs. So a lot of times, if the patient is admitted for, let's say, pneumonia, or they're having respiratory failure or respiratory disease, we're going to collect ABGs because we want to see what is the true accurate measurement of oxygenation in their bloodstream. If the patient, let's say, unfortunately, they're beginning to decline, right? So they're beginning to show signs where they're not doing as well, like they're not as alert, they're not as conscious, then we're going to collect ABGs because the patient is becoming unstable, and we need to know a more accurate representation of their oxygenation levels so we can respond more appropriately and quickly. A lot of times in this situation, we collect ABGs daily. Actually, we'll collect it when they're unstable, when they're ICU patients, or usually when they're ICU patients. We collect ABGs once per day because we're trying to once again see, if the patient is improving and getting better, along with other things such as chest X-ray and other blood tests. But ABGs is pretty much showing us the acid-base balance in the blood, the oxygenation in the blood, and it's more accurate. So it's kind of like, if you had to give somebody a life and death drug, would you want to know what is a close predictor of giving the drug, or would you want to know what is exactly the predictor to giving the drug? You want to know what exactly it is, right? So in the same regard, that's what ABGs is. It's just giving us an accurate measurement of what's going on in the bloodstream. So we have to collect ABGs, right? So it's not, because it's drawn from the blood, and there's a reason why it's called arterial blood gases, right? So because it's called arterial blood gases, we need to draw the blood from an artery. So that's really going to help us to identify what's going on with the patient, right? So we're gonna draw the blood from the patient's artery. So this is our bestseller. This book, I've had it since 2016. It comes in, y'all see that? Okay. Physical and then also ebook. So it has its ebook. There's an ebook version, there's a physical copy. The physical copy has 100 questions in the back, all right? So the physical copy has 100 questions in the back, the ebook doesn't. So just keep that in mind. So this is, like I said, our bestseller. You can see how big it is. It's covering like half my body, but
It's a really great book. People love this book because it really breaks down so many different simplified topics covered on the NCLEX. In this book, I put like tables in it. You know, the inside of it is not in color, so just know that it's black and white. All right, so, but here, put like tables in there, okay? Like a farm table inside of it. And then there's questions in the back as well. So like I said, it has the questions in the back.
And it is significant, that we're collecting blood from the arteries, because the arteries is what's carrying oxygenated blood, right? The arteries is what's carrying blood that's already been received oxygen from the heart and is taking it to the rest of the body as well as the capillaries and the cells. So this is why we're collecting blood from the arteries and not the veins. Do you see that? So for example, like when we get a vein, we're doing a vein we're trying to find a vein so we can stick an IV in there, right? So we can send, direct, quick IV fluid access or medications, right? So it's more so to give something that's intravenous, right, with a vein. But arteries, though, is where oxygenation actually, with the blood, is supposed to be oxygen rich. So what happens? Typically what happens is that if we start from where the heart is, we have deoxygenated blood, so oxygen that's not perfused, that travels through the heart. So it travels to the right side of the heart, it goes to the lungs where it gets perfused with oxygen, right? So it's supposed to go to the lungs to get the oxygen, which is why this is so accurate. So anyway, so deoxygenated blood, it enters into the right side of the heart, then it goes to the lungs, gets perfused with oxygen, comes into the left side of the heart, then it goes through the aorta, and then it travels throughout the rest of the body through arteries. And those arteries are supposed to carry oxygenated blood. So when we collect this blood sample, it will help us to see that, you know what, the patient the oxygenation isn't working so well, because the oxygenation is supposed to happen in the lungs. So if the lungs aren't doing very well, it will be reflected in the arteries. That's why you have to know the flow of stuff, because then it will make more sense. So arterial blood gases are drawn from the patient's arteries, and the most common place we're going to draw it from is the radial artery, all right, on the patient's wrist. Now, so in this picture is showing you an example of this. Okay, so here's the thing. I will tell you, I have never had to draw on ABGs before. Usually, ABGs are not usually collected by you. Now, then again, it may depend on the facility that you work at, but normally the respiratory therapist is supposed to draw the ABGs because, like I said, it has to do with oxygenation levels, right? So it's normally done by the respiratory therapist. It can be done by phlebotomists, but that's usually not as common because it does also require a sense of, different type of skills, so to speak. So usually it's done by the respiratory therapist. A nurse can do it, absolutely, you can, so you can learn to do it. But usually I've seen more so respiratory therapists are the ones that collect it. So there's complications, just like anything else, that can occur because we have drawn the ABG. So you need to know what these are. So we have several potential complications related to arterial blood sampling. Here below, this is a list of some of them. First one, arterial spasm. Okay, arterial spasm. And that's pretty much an involuntary contraction of the artery, which may be prevented simply by helping the patient to relax. This can be achieved, for example, by explaining the procedure and position the person comfortably. Then you have a hematoma. So a hematoma or excessive bleeding can be prevented by inserting the needle without puncturing the far side of the vessel and by applying pressure immediately after blood is drawn. So due to the higher pressure that's present in the arteries, the pressure should be applied for a longer time than when sampling from a vein and should be supervised more closely to check for sensation of bleeding. All right, so that's with a hematoma. Then you have another thing that can happen is nerve damage. So, and that would be, for example, if, we hit a nerve, which can be prevented by choosing a more appropriate sampling site, such as the radial artery, and avoiding the redirection supposed to be of the catheter. So far we have arteriospasm, which is now where they develop an involuntary contraction of the artery, a hematoma, which is too much bleeding, nerve damage. These complications, what I'll tell you too, it's usually pretty rare for this to happen. More complications we can see is like fainting or a vasovagal response, which can be prevented by ensuring that the patient is supine or lying down on their back with their feet elevated before beginning the blood draw. Patients requiring arterial blood sampling are usually inpatients or in the emergency ward, so they will generally already be lying in a hospital bed. Children may feel loss of control and fight more if placed in a supine position. In such cases, it may be preferable to have the child sitting on the patient's lap so the parent can gently restrain the child. Other problems can include a drop in their blood pressure, complaints of feeling faint or sweating or pallor that may precede a loss of consciousness. All right, so one of the things that we do before we collect an ABG sample, and although what I'll say about the NCLEX, for those that are taking your NCLEX exam, although you don't physically collect the ABG sample, you do need to know the procedure involved. All right, that is definitely on the test. And there's something called the Allen test. And this is something that we do prior to collecting the blood sample, and it should be performed to measure arterial competency. So here's the steps that we do, right? And you want to learn this. You want to instruct the patient to clench his or her fist, okay? Then to clench his or her fist. If the patient is unable to do this, you want to close their hand tightly for them. Then, using your fingers, you're going to apply occlusive pressure to both the ulnar and the radial arteries to obstruct blood flow to the hand. Then, while you're applying the occlusive pressure to both arteries, you're going to have the patient relax his or her hand and check whether the palm and fingers have blanched. If this is not the case, you have not completely occluded the arteries with your fingers. Okay? So, like I said, you're going to apply that pressure to both arteries, have them relax his or her hand, and then you're going to check whether the palm and fingers have blanched, whether they change in color. So once you do this, right, because now we know there's adequate pressure, so we can see if the arterial arteries are competent as well. This is how you'll know. So then you're going to release the occlusive pressure on the ulnar artery to determine whether it is a positive or a negative Allen test. So a positive modified Allen test is when if the hand flushes within 5 to 15 seconds, then it indicates that the ulnar artery has good blood flow. And this normal flushing of the hand is considered to be a positive test. All right, so obviously you want positive. That's what we want. So 5 to 15 seconds, right, that indicates as long as the hand flushes, so it changes in color, then this is normal flush of the hand. A negative modified Allen test is if the hand does not flush within, and you need to be patient to the time frame too, within the 5 to 15 seconds, then that indicates that ulnar circulation is inadequate or non-existent. And in this situation, the radial artery supplying the arterial blood to that hand should not be punctured. All right, should not be punctured. And so what's great about this teaching as well, it's highly visual teachings that's included, all in the formatted in the correct order. There are downloads there's a download with each of the teachings as well that you can download here. And then there's also like some notes below the video is in addition to that. And then when you're going through the teaching, we also include multiple assessment exams for you to complete as well. So the assessment exams kind of helps you to reinforce what you just learned in the teaching. There's also on top of the assessment tests, there's also exams, affirmations for you to listen to encourage you, quizzes, midterm exam, final exam, and answer keys for you to go through as well. It's pretty straightforward, but it's very comprehensive and very detailed especially for the repeat test taker. So you don't want a negative modified test, okay? So if it does not flush within that time zone, then it's negative, okay? So that is a significant test for you to be aware of. So what are some of the steps that if, let's say, for example, we were collecting the ABGs, what steps would we do, okay? If we were the one drawing the blood. So first and foremost, you're going to approach the patient, right? You would introduce yourself. You would ask the patient to say what their full name is. You're going to place the patient on their back, have them lie flat. You're going to ask, and this is, like I said, if it was another nurse or if you're the respiratory therapist, you're going to ask the nurse for assistance if the patient's position needs to be altered to make them more comfortable. If the patient is clenching their fists, holding their breath, or crying, this can change breathing, and thus after the test result, you're going to locate. Then step 3, you're going to locate the radial artery by performing the Allen test we just talked about for collateral circulation. If the initial test fails to locate the radial artery, you want to try the test on the other hand. Once the site is identified, then you're going to note the anatomic landmarks to be able to find the site again. So if it will be necessary to palpate the site again, you should probably put on some sterile gloves then, okay? Then you're going to perform hand hygiene, cut off any bedside work area, prepare the supplies, put on an impervious gown or apron, face protection, especially if you anticipate that the patient will, like, a lot of blood will be exposed, or, then you should put on something to cover your face, especially if the patient has, let's say the patient has, patient has MRSA or some type of contact precaution, anything of that nature, drop, whatever it is, you should definitely cover face protection. AIDS. You want to disinfect the sampling site on the patient with 70% alcohol and allow it to dry. Next, if the needle and syringe are not pre-assembled, you want to assemble the needle and heparinize syringe and pull the syringe plunger to the required fill level recommended by the local laboratory. So sometimes they'll send the kit of the ABGs and it's already assembled, it's already set up. So all you have to do is literally just withdraw the blood. It's not really difficult. If it's not assembled, then you'll need to assemble the needle and a heparinized syringe and pull the syringe plunger to the required fill level recommended by the local lab. So you're going to hold the syringe and the needle like a dart You're going to use the index finger to locate that pulse again. You're going to inform the patient that the skin is about to be pierced, and it is painful. It's definitely painful. It's about to be pierced, then insert the needle at a 45-degree angle, approximately 1 centimeter distal to the index finger, to avoid contaminating the area where the needle enters the skin. Then you're going to advance the needle into the radial artery until you receive a blood flashback. Then allow the syringe to fill to the appropriate level. So now that you've got the flashback, now the container where you're collecting the blood in should be filling. And you don't need to pull back on the syringe plunger. You're going to withdraw the needle and the syringe. You're going to place a clean, dry piece of gauze or cotton wool over the site and have the patient or an assistant apply firm pressure for sufficient time to stop the bleeding. You're going to check whether the bleeding has stopped after 2 to 3 minutes, which it should at that point. 5 minutes or more, you may be needed for patients who have, like high blood pressure, or if they had bleeding disorder, or they're taking anticoagulants. So definitely don't be in a haste. I recommend that you make, if you know they're on high blood, and in fact, you should ask that before you start anything. If you know they have high blood pressure, chronic kidney disease, bleeding disorders, anticoagulants, you should anticipate that the bleeding won't stop immediately, right? You should hold pressure for a little bit longer after you're done, just to make sure the patient stops bleeding. Usually we put a very strong, like I said, gauze over the site and tape, but you should still apply pressure though. Activate the mechanisms of a safety needle to cover the needle before placing it in the ice cup. In the absence of a safety engineered device, you're going to use a one-hand scoop technique to recap the needle after removal. Expel any air bubbles, cap the syringe, and roll the specimen between the hands to gently mix it. You're going to cap the syringe to prevent contact between the arterial blood sample and the air, and to prevent leaking during transport to the lab. Then you're going to label the sample syringe and dispose appropriately of all used material and personal protective equipment. Then you want to remove your gloves, wash your hands with soap and water, dry. If you need to use alcohol rub solution, once again, before you leave the room, check the site, make sure they're not bleeding, and then transport the sample to the lab. All right. So that's pretty much the steps to collecting the sample. What I would say is it's normally the RT that does this, but however, though, it doesn't hurt to know this information because this is an ABG's course, right? So, all right, so here are the references from this particular teaching that I went over in this training, and I will see you in the next training.